Now, India has surpassed Brazil to become the second worst hit nation by the COVID-19 pandemic. Speaking of which, we have a very important guest with us today, Dr. Ashok Seth. Dr. Seth is the chairman and cardiologist at Fortis Escort Heart Institute. Thank you so much, sir, for taking our time and speaking to us.
Pleasure speaking to you. Thank you.
Sir, I'd like to begin by asking, the World Health Organization has said that India has been reporting the highest number of deaths and the daily COVID cases. What is your assessment of the current COVID situation in India?
Right, we've got to look at it in multiple ways.
Yes.
Firstly, we must understand that India is a very populous country, in fact, the second largest country in the world, and also happens to be the third or fourth most congested country in the world as well.
Yes.
If you consider the population per square mile. Now, when we have such a situation, what we should look at not just absolute numbers, but the percentage of the country which is affected at the moment. So absolute number-wise, we are certainly high up there, but in terms of the whole population, we're certainly less than many other countries of the West. The second aspect is that, yes, this is a virus. It survives by spreading. It is contagious.
Yes.
And certainly in the West, there's a higher mortality as compared to India. Now, mortality is something, death is something which hurts us all, and we want the death rate to be lower.
Absolutely.
Spread of the virus is a natural phenomenon, and we have to do everything to limit the spread of the virus. But really, the consequence is that majority of the people, which is 80–85%, are going to have minor infections, almost just like a common cold. But it's that people who get very sick, which is less than 5%, and the ones who die, which hurts us. And thankfully, at the moment, the death rate in India has been substantially lower than many of the Western countries. You know, England, for example, had the death rate of around 10–14%, and that happened in Spain as well. But we see death rates of under 2%. Now, let's hope, and you know, death cannot be hidden. Death is obvious phenomenon. It's documented.
Yeah.
So we are actually therefore saying that let's keep our death rates down.
Yes.
Let's make sure that we don't get overwhelmed, because India is a vast country. The virus is spreading, and we actually got to take care of our people. So there's no question around that. But the second aspect also is that we must remember that we've really upped our testing phenomenally.
Yes.
So there are a number of reasons why we're seeing this. One is actual increase. As we unlock the country, it is bound to happen that as economy has to be opened up. So unlocking is a normal phenomenon. We've got to live with the virus. And we're going to see a spread of cases going to the hinterland, going downstream into the tier 2 cities. There's been a movement of population which has happened. Places which previously did not show the cases are now showing cases, and everywhere it's increasing. But we also have to understand the important fact that at the same time, we've ramped up our testings. We've seen that happen in Delhi itself. We're at 50,000, more than 50,000 plus cases, testings in a day. We're going to turn up more cases. Thirdly, there's going to be movement of people now that restrictions are being lifted, more intermingling of people. Economy is opening up. Transportation is opening up. International, national, as well as domestic travel is opening up.
Yes.
Trains and the metros are opening up. They will have to open up more and more. It cannot be lesser and lesser.
Yes.
Gradually, this will open up more. Schools are going to open up. So what we're going to see is a gradual increase of the virus. Therefore, what happens? The ball is now in our court. We, as the citizens of this country, owe it to ourselves and the others and our families to prevent the virus from spreading. And if we continue to take precautions and break the chain of the virus spread, then we may actually control the situation, not just of the numbers, but actually of the deaths as well.
Yes, yes. Dr. Seth, as you rightly pointed out, the country has ramped up testing. So the increase in number of cases or the daily COVID cases is mainly been attributed to the ramping up of testing or the increased number of testing. But the deaths have also increased drastically, and people are worried because a lot of experts had said that this is not such a deadly virus, and you only lose your life when you have a comorbidity or when you have an underlying disease. So why exactly are the death rates so high? Even today, there are more than 1,000 deaths in the country.
See, the death rates still are under 2%. And I think I just want to tell you that the total number of deaths are increasing, and that's going to be in proportion to the increase in number of cases. So
Right.
we're not looking at absolute numbers, we're looking at the percentages of deaths. And certainly, look at Delhi, it's 1.5, 1.7%. So don't think in a day we can actually decide whether the deaths have increased. Total absolute numbers will increase, the deaths will increase proportionately. It's very clear that our death rates are still low. But let's not just dwell on the fact of the death rates are low as being a comfort.
Yes.
We must remember the fact that anybody dying, I mean, whether it's 1.5, whether it's 2, whether it's 2.5, we've got to protect even that 1.5 and make sure we get as low as possible in the present circumstances. When I expressed the reasons for the increase, let's not forget also the fact that what is a lockdown fatigue which has happened in the patients, in the public. We are not seeing the discipline that we would like to actually see. So while we may say that the numbers have increased because of testing and the numbers increase inevitable, but there's nothing like inevitability. I do understand there's a proportion which is going to be inevitable, because sometimes when we talk about physical distancing, unfortunately, a large proportion of our people live in such socioeconomic circumstances where talking to them about physical distancing is a harsh joke. They survive by living in small congested surroundings. A family lives in a 10-foot square room. And for them, and they've got to lead a life of selling, say, vegetables on the streets, or selling small shop of pan and cigarettes and things like that, or even not just pan and cigarettes, but even small stalls of serving food to others. Now, how do such people actually talk about physical distancing when the person has to go and fetch vegetables from the market at the cheapest prices?
Absolutely.
So, but what is definitely possible is for us, a lot of educated people, to understand how to pass this on further. I think when I talk about discipline, I see, unfortunately, that discipline missing in those people who could have physical distancing, who could have actually distanced themselves, who could actually, mask wearing is all across. It doesn't require a socioeconomic education or stature to actually wear a mask. But the sadness of it is that the mask wearing, unfortunately, even in the most educated circumstances, is on the neck rather than even covering the mouth and the nose. Appropriateness of mask wearing is not just protection of your own self, but you owe it to others to protect them. You owe it to the public to protect it. There is no way you have the right to harm the public. So the wearing of the mask is not for your own sake, it's for others' sake. And think of the fact, and I keep on emphasizing this, I say it's not just the public, it's your own family. You may be actually doing the harm to the whole family. The virus from you, which you may acquire, and you may say, I don't care, I'll take my own chances, I'll recover. But what about when you transfer it to the rest of the family? I have known families in which one person got infected. The younger people in the family recovered, but unfortunately the parent passed away. And the elderly granddad passed away and the whole family is shattered. But it was actually one of those small mistakes which happened from one member of the family which transmitted the virus to the rest and created such a sad situation. And this is not an unknown phenomenon. So what I'm actually therefore saying is, now this is the other sadness, that whenever we speak, we take the mask off. Whenever, and that seems very odd. That's when we need the mask the most, to cover our noses and face. Now I'm only sitting here without a mask because I'm alone in this room. But the moment I go out, I do wear a mask. And even with my 95-year-old father at home, I wear a mask. So mask is within our control. Hand washing, hand sanitization is within our control. Physical distancing may not be in control of many people because of the socioeconomic circumstances they live in. But put these three things together and we would be able to stop the spread of the virus. This virus requires to get into a human being to stay alive. If it cannot find a human being to get into the throat, it won't stay alive, it'll gradually die down. And we have to aim for that meticulously. See, I mean, I know that I'm emphasizing on this, but I believe that this is the biggest single factor that we have at the moment in our armamentarium to be able to limit the spread of the disease and to be able to flatten the curve, as we say.
Yes.
The virus is going to be with us for a long period of time, but we will have to know how to control it. We will have to know how to keep it flat. We will have to know how to prevent it from going out of control, that it doesn't create havoc. And that is partially the government's responsibility to provide us the facilities, but the government has done its job to let the economic recovery happen. Lockdown cannot be forever. Economic recovery, unlocking, life getting gradually back to the new normal has to happen. But how to create the new normal is now our responsibility. Actually, the ball is now in our court. It's in people's courts. It's in the public's court. It's a national cause.
Absolutely. Dr. Seth, I'd like to understand, as a cardiologist, how vulnerable do you think people are, especially with underlying diseases, say heart conditions or diabetes, to the ongoing COVID situation? How careful should they be?
Yeah. This is a very important question. But before you come to this question, I would also like to address one more fact. And the other fact is that we are partially lucky. We have low mortalities. And you may say the mortality absolute rate increases, but in terms of percentages, we're still pretty comfortable at less than 2%. And there are multiple reasons for that. Of course, there's been talk about whether previous numerous infections that the Indian population may have faced has created some form of a resistance or some form of an immunity.
Yes.
Data is weak for that, but then there's also talk about the BCG vaccination and many demographics and many studies which say countries which had a very strict BCG vaccination program have low incidence of COVID disease. But there's also, we must not forget the issue that there's also been more defined treatment protocols over this period of time. We locked down early. And when we locked down early, the virus spread less. We were able to build up our infrastructure, but at the same time, more defined protocols of treatment and management for COVID disease came in. And if you remember the first couple of months of treatment of this disease, it was so haphazard. Anybody who had anything which thought it would work, whether it was anti-AIDS, whether it was antiviral, whether it was antibacterial, whether it was reprocessing the previously used for Ebolas and things like that, everything was put into the bag and said, let's just give this, hope it works.
Yes.
But we now have better defined protocols, more trials which have proven negativity or positivity. And therefore, when we treat today, we're actually having a more definitive management. Having said that, we still don't have a proven cure for the virus, by the way.
Yes.
The only thing which seems to have decreased mortality or deaths is steroids, dexamethasone. The rest are supportive, have shown some benefits in some manner or the other of decreasing the viral load and so on and so forth. But at the end of the day, our treatment protocols have got strengthened to try and at least predict those who are deteriorating, have the timing of these treatments appropriately defined, when to institute the high-end treatments at the appropriate time, and when do we expect the results rather than leaving many of these experimental treatments to the last moment when we can't save patients. Now, coming to the cardiac issue, which is an important issue.
Yeah.
We know that coronary artery disease increases with age as well.
Absolutely.
At the moment, we can't very confidently say that heart patients are more prone to develop COVID disease than any other member of the population. That data is perhaps not there. So at the moment, we feel that heart patients have a similar risk of getting COVID-19 as any other population, which therefore means that heart patients have to take the same meticulous prevention and precautions as anybody else. Or the other way around, those who don't have heart disease need to take the same amount of precautions as a heart patient, which is meticulous. But what is very clear is that those who have heart problems do get more vicious, more serious, and more dangerous form of COVID-19 disease process.
Yes.
So the chances of that going to the lungs, creating bad lung infections, the chances of it creating a heart attack, the chances of damaging the heart to create muscle weakening, what we call cardiomyopathy, to drop blood pressures, to go into a shock situation, to cause arrhythmias, all the risks, all the worsening of the heart happens, it becomes just a more serious disease process. So that is well recognized, and that is why. But then there's also the fact that because more heart patients are elderly, we also have hypertension in the same patient. We also have diabetes commonly in the same patient. So unfortunately, age, diabetes, heart, as well as hypertension form a very complex conundrum, which results in extremely severe infections and is the commonest cause of death. And that is why we see elderly patients have a very high death rate. When we talk about this less than 2% death rates, we also must remember that majority of those deaths are happening in this above 60 years of age and certainly above 80 years of age. And the reason we think about low death rates in India is because India is a relatively young country.
Yes.
Having said that, so the heart is affected in multiple ways. It can be a direct effect on the heart. And I could go into that if you want me to. I don't want to take up too much of the time dwelling on it, but if you want me to go into the way the heart gets affected. Okay, so the heart gets affected in three manners. And I would say the most severe, the COVID, as far as lung infections concerned, and we call that lung infection, but we must remember, it's not direct lung infection. What it is that it causes microcoagulopathy, where clots form in the lungs. And it's both an immunological inflammatory reaction which happens in the lungs, along with fine clots in the arteries of the lungs, which lead to the severe form of acute respiratory distress syndrome. But the similar mechanism also happens for the heart. So the virus can cause inflammation in the arteries of the heart. It increases blood coagulability and clotting in the arteries of the heart, leading to heart attacks. It can directly, due to its inflammatory responses and reactions, cause damage to the muscle of the heart itself, leading to weakening of the heart muscle, and suddenly the pumping efficiency of the heart dropping from its normal of 60% to 30%, 20%, suddenly presenting as a syndrome where a person is in heart failure, unable to support himself, the blood pressure goes down, the patient goes into a shock situation.
Yes.
And then it has to be supported by mechanical pumps, etc., to maintain his life. And finally, the virus also causes arrhythmias, affects it causes inflammation of the conduction tissue of the heart, causing the heart rate to go either very fast, and these are very serious life-threatening heartbeats coming at 150, 160 per minute, or actually making the heart very slow and going into a heart rate of 28 to 30, again proving dangerous for the person.
Yes.
And this happens practically in 20% of the people who have COVID-19 disease, or at least more serious form of moderate to serious COVID-19 disease. And by the way, some form of heart affection, especially to the muscle of the heart, weakening of the heart muscle, on an MRI scan is seen in 80% of the COVID patients. So it does start worrying us that the more we look for heart effect in COVID patients, the more we find some element of heart being affected in up to 80% of the COVID patients. And of these, 20% can be serious heart affection. So we are very wary of all this. We certainly tell our heart patients to be very careful, and we actually supervise. The heart patients can also deteriorate once they get COVID. So pre-existing heart problems can actually deteriorate when COVID-19 occurs. Patients can actually get heart attacks on a pre-existing, people with pre-existing stents can actually have a clotting within their stents. So we up their blood thinners. We actually protect them far more when they get COVID-19 if they have pre-existing heart disease, and monitor them far more closely for any signs of deterioration of their heart condition.
Absolutely. Dr. Seth, I'd like to understand how overwhelmed are hospitals right now? I mean, this is the ongoing COVID situation is something definitely that we're experiencing as a country for the first time. How equipped were the hospitals before or during the outbreak of the virus, and how equipped are they now if in case we have another outbreak sometime in future?
So we've gone through phases of that. We went through initial phase because we locked down when there were only 500 patients in this country.
Yes.
At that stage, we witnessed the West being where COVID had become totally rampant in Italy, in Spain, in the UK, and then in New York. And we saw those visuals of the hospitals getting overwhelmed, where patients and ambulances were lining up the streets just to get to the emergency.
Yes.
Where unfortunately patients were dying, and we were seeing those hearses being parked in front of a cemetery. And that truly worried us. So I think it was appropriate at that time to lock down, because truly, if that situation had come to India at that particular time, our systems would have been totally overwhelmed, knowing our population and knowing the fact that our systems are only a patch on what exists in the West. The number of beds per patient, per population is only a patch on what exists in the West. We would have been overwhelmed. We didn't have PPEs, neither did they. And that's why the problems are happening.
Yes.
But we didn't have PPEs either. We didn't have N95 masks, neither did they. But we therefore had the time to actually accumulate all that. And I remember the first time, I must say this, that in the first week of lockdown, where we said, let's get PPEs and start stocking them, because we didn't know what to expect in 4 weeks and 8 weeks time.
Right.
We actually had to wait for 10 days for a PPE, which used to cost us at that time 2,500 rupee a PPE, and 95 masks. We got a stock of them, and after that, they became unavailable.
Yes.
And soon became ridiculous priced. Well, 2 months later and 3 months later down the road, the PPEs were lining up, 200 PPE manufacturers. It is available at 400 rupees. The N95 mask, as you know, is available at every doorstep. So not just on that infrastructure side, but we then started realizing the need for ventilators, which would be needed across the country, because we saw a rationing of ventilators happening even in advanced systems like United States and Italy and Spain, where their heart wept, the anesthetist heart wept, the cardiologist heart wept. And we've seen those visuals, and we've seen our friends talking about it, who said, I had to actually decide whether that 78-year-old should be put on a ventilator or the 45-year-old to be put on the ventilator, because there was only one ventilator available. And I therefore gave it to the 45, and the 78-year-old died. Now look at that, that hurt. Luckily, we didn't have to go through those stages. None of us had to. The worst we did get to is when we started opening up, we realized that yes, these cases are getting out. And certainly at one stage, when the government, at least in Delhi, instituted all the hospitals to actually have COVID beds, I think it was a good move. Initially, it seemed to us, oh my God, we as a heart center now need to be a COVID center as well. I mean, I don't know how to handle a COVID patient, but we all realized that it was all hands on the deck. If it wasn't, then we would lose the battle. And I think it was great to actually have all hands on the deck. So in the first week, while we thought that how are we going to manage this? Soon all of us actually took pride in handling COVID patients. It was in a way our duty. And the fact that we've done not just duty to the patient, we've done duty for the nation at time. And that's how we feel from there onwards. So initially our COVID beds, 100 COVID got full in a flash. At that stage, we realized that we may actually need far more COVID beds. But gradually, as Delhi certainly conquered it, we actually saw the bed now only 60% full. But yes, we need more ICU beds. And certainly at this time, what we feel is that we'll need more ICU beds, because we must remember, we had numerous brains working on it. I think it's exemplary that lots of experts in a scenario which nobody's ever seen, in a path which nobody's ever treaded. In fact, in the paths of the West, I'm sometimes glad that we didn't follow some of those paths in the West, because we may have been in a bigger disaster that we did. We had to look for innovative approaches. If you saw Sweden took the path of herd immunity and suffered numerous deaths from it. Had India taken the path of immunity, we would have been floored with lakhs of deaths.
Yes.
England started taking the path of herd immunity and soon realized that they were having piles of people dying and suddenly went late into a lockdown and gradually came out of it with 10 to 14% death rate. United States took that delayed path of a lockdown and saw the thousands of people dying,
Yes.
the highest death rates which are ever there. So glad we didn't take those paths, because that's what we've been able to control. So therefore, we actually saying that at this time, certainly other areas of the country are needing the beds, where certainly the growth has been late as it goes interiors, but the preparedness is there. We still at this time have 60% of our beds. Remember at that time around I'd say 2 months ago or 3 months ago, when we used to hear every day that someone was there complaining that they didn't get a bed and they were going from hospital to hospital,
Yes.
trying to look for beds, and it was a sad state of affairs. That's no more. Our 100 beds were full. Now we're at 60 beds, which are full, and 40 are still available. We have ICU beds available. More ICU beds are created. Look at the vast number of beds which have actually been built, the 1,000-bed hospital which has been created. We're actually looking at readiness and preparedness at every step.
Yes.
But we should not be complacent, because we don't know what lies ahead. We hope that we will flatten the curve. We hope that we will not need more beds, but I'm not certain of that. That just in absolute terms, as you say, we're going to need a lot of beds. Yes. But the preparedness has to be there. We've got to be we've got to be ahead of this virus. We've got to be 2 months ahead of this virus. We've got to actually have all hands on the deck all the time. We as cardiologists, every cardiologist needs to be a COVID specialist. Every physician needs to be a COVID specialist. Absolutely. And every radiologist needs to be a COVID specialist. Every doctor needs to be a COVID specialist. And on the other hand, we also have to remember that a lot of people can actually be treated at home and are being treated at home. And that is why we have the availability of beds. It's not as if, it's not the fact that patients aren't there, patients are rising, but we've also realized that we've developed efficient systems to treat patients at home. Yes. Majority of them will get better. We have systems into place to monitor them. We've systems and also educated them enough when to come to the hospital. And we've created the beds for those who cannot be managed at home for one reason or the other. So I think our defined systems have got more robust to keep the death rate down and yet be able to treat a larger number of people, not necessarily just in hospital, but also at home.
Absolutely, doctor. I think you've simplified it a lot for us and the viewers. This is still a virus that we're learning about. We don't know too much about the virus, still new. And I think you've really given a lot of valuable inputs. So I'd like to thank you for joining us and speaking to us.
Can I take a minute more?
Absolutely, absolutely, doctor.
So it's very interesting. We must remember that we cannot sit here, or anybody sits around in any panel. They talk truly as experts around a virus which we know so little of, or a virus for which we've still not found a cure. Absolutely. For a virus which is still replicating in every country and only expanding, for a virus which is totally new. There has not been a virus for the last 100 years which has taken the whole world and every country and has stopped the whole world in its tracks to shut the whole world down. It's never happened, and it's been not thought of. Nobody can pretend to be too knowledgeable about it in 6 months for such a virus. And that is the reason why we keep coming up with new thoughts, new ideas, with new evidences, which often tell us that what we thought or were thinking about 3 months ago is probably wrong. And it's like this, or it replicates like this. We still don't know how long an immunity from this virus lasts us. And that's why you keep seeing reports around new infection happening in somebody who had been infected with COVID in the past. We don't know whether it's 3, 6, 9 months or whether it give us immunity forever. We actually are therefore only as knowledgeable as we are today. And our predictions for tomorrow and day after are only predictions as much as our brains can think about something which know too little about. But one thing has to be emphasized and emphasized and emphasized. What has been clearly shown to defeat the virus is two people wearing masks.
Yes.
The transmission of that virus gets stopped if people wear masks. Now, the mask has got to become a part of our lives, but that's not unfortunate. Think of it as a fortunate event which has happened. That it's going to be a part of our lives at least for quite some time. That's the only way to stop this virus, to keep ourselves clean, to not touch each other, to distance, and to wear masks. If we wear masks, we stop the spread of the virus. That's one thing which we have in our hands. We actually have to do it, and we have to do it properly. And if we do it properly, we actually win for our people, for our relatives, for the other people, and then for our country.
Absolutely. Doctor, I think you made a very important point, how we're not just responsible for our health, but others as well. It was wonderful speaking to you. Thank you so much for joining me.
Thank you. Thank you very much. Pleasure speaking to you.
Thank you.